I'm Dr. Jameel Smith, pediatric psychologist at Wayne Pediatrics, and welcome to this episode of Detroit Peds Talk. So, during the holiday season and winter months, research shows that while it's enjoyable for some, it can present stressors that affect children's mood, family schedule, and eating habits. And so, today I'm joined by our allied health team members at Wayne Pediatrics to help us explore this topic. I have with me Amber Moreland-Clark, who received her training in social work from Wayne State University, and she supports case management and behavioral health at Wayne Pediatrics. And then Derek Johnson completed his graduate training at Madonna University, an internship at Henry Floral Health, and is our practice dietitian. Welcome, Amber and Derek.
Hi.
Hello.
So I know both of you are supporting families this time of year and can share some strategies for achieving overall wellness during this season. So, Amber, first, I wonder if you can help our listeners understand what is seasonal affective disorder and why should parents be looking out for this with the young people in their home during this time of year?
Yeah, thank you. Well, first, thank you for having me, Dr. Smith. So SAD, or seasonal affective disorder, is it's a form of depression that happens in a person only in a specific time of year. So specifically like those winter months or when we get daylight savings time in November, that's typically when it starts to happen. So seasonal affective disorder occurs when there's a lack of sunlight, which changes the serotonin in our body. So like that feel good that we have in our body, that lacks. And as a result, we increase melatonin. And as we know, melatonin in our body causes us to feel a little tired or like fatigued more often in those winter months. So I think it's important for parents to know what SAD is and to be able to identify those signs and symptoms of SAD so that they can help their younger person get through these tough times in the year. I also think that it's important for parents to know what SAD is because sometimes or as parents, we might not know how to communicate um, with our children. So it's important to keep in mind that they have their own thoughts, feelings, and challenges around these winter months.
Yeah,
So to talk about it.
right. Um, and when you think about season, if you've heard of seasonal affective disorder, thinking about how children and adolescents can be affected by it might not be something that parents have thought about. So thank you for, helping us understand what it is. And so, how can parents support their kids, their children, their teenagers during this season?
So I think the most important thing is to take it seriously. If you have a child that comes to you and says that they're feeling a little sad, I think that it's important to schedule that doctor's visit and not to put it off because that can, trigger other symptoms and signs of different traumas that we might not even know about. And if your kid is diagnosed with SAD, I think that it's important to not only educate yourself, but educate them in what it looks like, not only during the holiday time, but, after the holidays, what that can look like for them and have them be comfortable with talking to you about it so that you guys can find some sort of resolve.
Yeah.
I also think that it's important to encourage, like your kids to go outside and play. Like that exercise is gonna help boost the serotonin that we're lacking, and just getting outside is going to increase the light from outside. So we're getting that vitamin D that we're also lacking, and also establishing a good sleep routine. If we stick to a specific and a strict, like bedtime regimen, then we can, reap the benefits of waking up early and getting that extra sunlight that we need. So I think all of those are really important.
Yeah, and I think what you're highlighting is there is actually a way that we can do something about the way that we feel if we're affected by this. It doesn't just have to take over. We're not totally helpless with it. And so I think those are all some really great strategies that work for kids during this time of year and all times of year. So
Hmm.
yeah, that's really great. And so with the holidays, you know, they can be particularly stressful sometimes. What are some things that parents can be thinking about to help young people manage holiday stressors?
Well, I think that for the parents, it's important to, manage our own stressors. Um, not only are the parents the example for the children, but it's important to keep our own stressors in check and provide mental health and self care for ourselves so that our stressors don't become our children's stressors. Getting enough sleep, eating healthy meals, getting that exercise is all important. Not only as for the parent, but as a family as a whole, that can really like boost our moods and give us that extra serotonin that we need, so that we can get through the holiday season and we can like feel like our like our normal self, even though we're lacking a little bit in some areas.
Yeah, yeah. And so, Derek, often it can be difficult when thinking about healthy eating, and getting through the holidays. And one of the reasons why I wanted to talk about this is because we know that food is a central part of our culture and how we just celebrate together, whether it's the holidays or not. And so this is fine, this is okay, but sometimes we need to think about how parents can support both enjoying this time of year for kids and supporting healthy eating. So, how can parents get through this season with healthy eating in mind?
Well, thanks for having me, Dr. Smith. A good thing to keep in mind when going into the holiday season is to kind of have a plan, especially if you're going into a Christmas meal, to make sure you're not skipping breakfast and lunch going into the Christmas meal, not eating anything all day, which would kind of cause you to overeat at that meal time. And then especially remembering that um, to watch just over excess eating throughout the meal. Watching kind of portion sizes is always a good reminder for healthy eating during the holidays, to make sure you're just not over consuming.
Mhm.
Another thing is you can also kind of just consider hosting the dinner, so you have a little bit more control over what's being cooked. Not saying people can't bring food items with them, but it allows you to have a little bit more control within the house. And also leading into, if you are going someplace else, you can always bring a food item with you, which is, you could try like a little bit more healthier of an option, as far as like cauliflower mashed potatoes, or a vegetable, or kind of like a seasonal salad, instead of the heavier items like mashed potatoes and gravy and things like that.
Yeah, yeah. Well, that's making me hungry already. But those are really some really good considerations. Um, so thank you so much, Amber and Derek, for helping us think about how to enjoy this time of year with wellness in mind. The holidays and winter months can bring mixed emotions and experience for our families. So we want to help children to manage their mood and act in ways that support family wellness as we get through this time of year. So, in making those healthy choices and managing holiday stress and getting through seasonal sadness, if that's difficult for you, there's hope. Keeping a good routine for everyone in the family helps to, just create some good habits around eating and just managing stress and practicing what supports your family's wellness, and managing your child's mood and asking for help if you need it. Often, your child's pediatrician, is a good first step to problem solving how to implement these good strategies that both Amber and Derek have shared with us. So I'd like to thank again Amber Moreland-Clark and Derek Johnson, our allied health team members here at Wayne Pediatrics, for joining me today for this edition of Detroit Peds Talk. For more information about Wayne Pediatrics, please visit waynepediatrics.org. Also follow us on Instagram and Facebook for new shows posting monthly every Wednesday. And remember, pediatricians are the best option for the medical care and needs of children. Take care.